Alberta Public Health Insurance. Alberta has a publicly administered and funded health care system that allows eligible residents to access medically necessary hospital and health care services. This plan is called the Alberta Health Care Insurance Plan. So what does the Alberta Health Care Insurance Plan provide? Also referred to as AHCIP, it covers health care costs such as medically necessary physician's visits, diagnostic services, like labs tests and x-rays, and hospital accommodation. However, comprehensive cover and access to dental care, vision care, and prescription medications are not covered under the Alberta Health Care Insurance Plan. You will need supplemental insurance, a private health insurance plan, to cover these needs and avoid substantial out-of-pocket expenses. How to get AHCIP? All eligible Alberta residents must be registered for the Alberta Health Care Insurance Plan (AHCIP) to receive insured hospital and physician services. To file an Alberta Health Insurance application for the AHCIP, you will need to complete the AHCIP application form and submit it along with supporting documents. The required supporting documentation is proof of Alberta residency, proof of identity, legal entitlement to be in Canada. Once you have completed the application and have your supporting documentation, you can submit your application either in person or by mail. If you opt to submit your application in person, the processing time is as quick as 5 days. Otherwise, application processing time can take up to 6 weeks. Your coverage will begin once your application is approved and you are registered. What does the AHCIP cover? What is covered by Alberta's healthcare system? Physician visits, psychiatrist visits, diagnostic services including laboratory, radiological, x-rays, oral and maxillofacial surgery services, bariatric surgery for Albertans who are eligible under the Weight-Wise program, breast augmentation and mastectomy for transgender surgery, hospital visits and stays, nursing services, medications during hospital stay, operating room, care room, radiotherapy, physiotherapy, and anesthetic facilities, interfacility transfer in Alberta by ambulance. The AHCIP provides partial coverage for podiatry, optometry, and some specialized dental services only in Alberta. These services have benefit limits or maximums per benefit year. What is not covered by Alberta Health Care? There is a sizable number of treatments that the Alberta Health Care Insurance Plan does not cover. Complementary or alternative medical treatments, such as a chiropractor, massage therapist, naturopath, nutritionist or social worker, psychologist and therapy, routine surgical equipment and supplies, accommodations at a standard level and meals, cosmetic surgery, e.g. tummy tuck, unless medically required, prescription medication, drugs other than those prescribed during a hospital stay, eye examinations for adults aged 19 to 64, unless medically necessary, eyeglasses, contacts or laser eye surgery, medical appliances or mobility devices such as wheelchair, hearing aids, dental treatments, ambulance services unless transferred from one medical facility to another, most contraception. Therefore, private health insurance can help you not only access better care when you need it while providing greater peace of mind. We highly recommend getting private health and dental care in Alberta. You can compare health insurance Alberta plans using our comparator at this top of this page to make the best decision based on your unique needs. While the Alberta Health Care Insurance Plan is available to many individuals, there are some exceptions to who can get coverage. Non-eligible residents include refugee claimants, refused or failed refugee claimants, people with expired immigration documents. If you find yourself in one of those categories, it is recommended to get a private health insurance policy, as you will have to pay for your own medical expenses. If you are traveling to Canada, you should purchase travel insurance from a private insurance company before arriving in the country. What is covered under Alberta Health Care for seniors? The Alberta Health Care Insurance Plan, AHCIP, covers several health services for seniors in Alberta. Physician visits. Alberta Health Care provides coverage for medically necessary visits to physicians and specialists. Hospital services. Coverage includes hospital stays, nursing services, laboratory tests, and diagnostic procedures. Oral and maxillofacial surgery. Coverage is provided for certain oral and maxillofacial surgical services. Eye exams. Seniors are eligible for coverage for eye exams. Specific medical conditions treated by optometrists. Coverage includes treatment for certain medical conditions provided by optometrists. Dental services. Routine dental care is not covered for adults, but some specific dental, oral, maxillofacial surgical services may be covered for seniors. It's important to note that AHCIP does not cover certain health services, such as prescription drugs outside of hospital stays, eyeglasses, hearing aids, cosmetic surgery, and most dental treatments. Does AHCIP cover international students? International students in Alberta are required to have health insurance coverage. AHCIP provides healthcare coverage to eligible Alberta residents, but it doesn't generally cover international students. International students in Alberta are typically required to purchase private health insurance to cover their medical expenses while studying in the province. Many educational institutions in Alberta provide health insurance options for their students, particularly international students. The specific requirements and details of health insurance for international students can vary, so it's essential to check with your educational institution and relevant authorities in Alberta to ensure you have the correct and up-to-date information on health insurance options and requirements for international students. Does AHCIP cover visitors to Canada? AHCIP is designed to provide healthcare coverage to eligible Alberta residents, which generally does not include visitors to Canada. Visitors to Alberta, whether from other provinces or from abroad, are not typically covered by AHCIP. For visitors to Canada, including those visiting Alberta, it's recommended to have private health insurance to cover medical expenses during their stay. Travel insurance is a common option for visitors, as it can help cover unexpected medical costs, emergency medical treatment, and other health-related expenses. Health Insurance Alberta for Visitors plans are available under several popular providers like Blue Cross, Sun Life, and more.